initial experience with global healthcare really began in the Vietnam War when I saw the discrepancy of treatment between civilians and combatants. I saw a person who was lying in bed with a fractured femur, which is a thigh bone. This fracture could have been treated very easily with what we call internal fixation, placing a nail up through the bone or a plate on the outside of the bone. But the patient had lain in traction for 3 years. The reason? He couldn't afford the implant. A patient with a fracture, especially a breadwinner or a parent, spiral into poverty with the family for 3 generations. What happens in a developing country when there's a fracture and the patient doesn't get surgery? The children are taken out of school. The wife has to come in to care for the husband, and it's even worse if the husband has to try to care for the wife. Because in a developing country, the food, dressing changes, and all of the patient care is done by the family, including the physical therapy. So it's a big deal, and if we can decrease that disability, we can help many people.
Lily is a 50-year-old woman who had been laying in bed, I think in traction, for 7 weeks with an injured hip. Her grown daughter had to come to the social worker and tell her, "We don't have the money to be able to pay for my mother's implant." That was heartbreaking because I kept thinking of my own mother, and she died of an illness. And I remember what it felt like going into the hospital and being upset that she had to share a room with one other person. Every time we went into the ward, I would see Lily sharing a bed with a complete stranger. And I thought how this poor daughter of hers had to make this choice, had to make a choice between feeding her own 3 children or spending the money on her mother's implant, which was way beyond their means. Sign fills an orthopedic void that is left in the hospitals because the patients can't afford to buy implants, the hospitals don't have the budget to buy implants, and the surgeons have the skill, but they don't have the tools that they need to be able to treat their patients properly. Sign provides that. Sign designs, manufactures, and distributes orthopedic implants to hospitals in developing countries. The operations and engineering departments focus on designing and manufacturing our FDA-cleared products. They are the people who meet with the orthopedic surgeons to get design inputs and to find out what features the surgeons want to have in the equipment and in the implant so that they can better serve their patients.
The Sign system has participated in 70,000 surgeries around the world. We're in 47 countries, we're in the poor countries, and we continue to expand.
The beauty of the Sign system is that when we come into the hospital, we can teach the surgeons how to use the equipment within a matter of a few days, depending on the number of surgeries we can do with them. And then they see immediate results because the patients are able to leave within 3 days, go home, heal faster at home, and return to their jobs and able to sustain their families.
We want to continue to improve both in quality and in quantity. We want to increase the number of patients that we can help. We want to empower an increased number of surgeons to help their patients. It's very discouraging in a developing country to learn about things, to read about things on the internet that can be done to help patients, and they don't have the instruments or the implants to do this, and we want to supply those.
Think about it. 20 to 50 million people are injured every year. That's 60,000 people a day. It's taken Sign staff and surgeons 11 years to treat 70,000 patients, and we're really proud of that fact. But our dream is to treat another 70,000 people within the next 2 years. Sign staff and surgeons are ready for the challenge.
We want to spread our passion to people in developing countries, surgeons, patients, and to people in the United States.
We need you to make her dreams come true.